and then I go to jail for assault as an adult, what do you guys think you would do to mitigate that from occurring again? So that's what I tell the judge. What do you guys think? This is a question to the group. Someone's constantly fighting their entire life. How do we help that individual? Doesn't matter. You just try. Go ahead. I think you're ready to shoot. One of you two. Go ahead. Try.
Okay, so they're fighting their whole lives, right? And we want to prevent that. So I think personally, as a hopefully future psychologist, I would kind of try to see when did that start, why did that start, continuing, and whether he or she had like the environment to help them get out of it or not. Because if they did have that environment and they continued behaving in that way, then other approaches need to be taken. But if that was not present, then maybe we should start from there and then see if there's any changes.
I love that. And their environment was the problem, right? So to mitigate that risk factor, I am going to create a new environment. And that environment is my healthcare. So if they're coming to see me every week, I'm going to do anger management groups, work on emotional regulation with them on a weekly basis, and then they will not be assaulting people anymore because they'll understand their emotions, understands how their emotions change, understand when they start to get angry and how to have better coping responses, right? So that's what I present to the judge. Like, if this has been a problem their entire life, if substances were a problem their entire life, then I'm going to put them in substance treatment, right? So I'm going to change the individual's environment so that they can have a different trajectory. And that's what I'm presenting to the judge. And they usually trust our opinions because we're putting those interventions in place so it doesn't happen again. Any questions on that? Good. All right. So that was one type of assessment that I used to do, the diversion assessment. And then there is the incompetent to stand trial assessment. Incompetent to stand trial, usually someone has an IQ below like 70. I don't know if you guys know a bell curve. You guys seen a bell curve yet, right? The bell curve, right? So 70, average is in the middle of the bell curve, and they are on that very, I think, 2 standard deviations below the mean. These individuals do not understand. Sometimes they do have a mental health symptom, so that would be like an intellectual disability. That'd be one reason you are incompetent to stand trial. Some people think they are in control of the world. So they'll stand in front of a judge and they'll tell the judge, I'm in charge of you. You have to listen to me, judge. I have magical powers. So those people that have these delusions, they're incompetent to stand trial as well. And others who have hallucinations, they're incompetent to stand trial. Usually these people get put in state hospitals. So they had an episode with their schizophrenia, committed murder. So they're very dangerous, but they're still schizophrenic. So we have to put them somewhere. So our nearest one to here is Norwalk Hospital, State Hospital. There's one in San Diego, and I think there's one, no, Norwalk's the closest here. So anybody who commits a crime like that, we will do reevaluations on them every 6 months to see if they need to remain in the hospital. If their symptoms get better, they'll go to trial for murder or whatever the crime is, and then they'll go to jail. If their symptoms stay the same, which they usually do because they're under medication, we just do reevaluations about every 6 months. So we'll go in there, half the time they cannot speak to us, they can't talk to us because they're just unable to because they're so highly medicated. I'll ask them a few questions. They make questionnaires similar to that form that I just gave you guys. They'll make questionnaires and I'll go through a list and I'll be like, where is a judge located in the room? And if they are, I guess if their symptoms are really bad, they'll just start saying something very off the wall to me. I don't know who the judge is. I'm Mickey Mouse, right? They'll say stuff like that to me when I'm engaging with them but I'm going to continue with the questionnaire because as I present that evidence back to the courts, they need to know that I did my due diligence and the individual symptoms, I feel very confident that they need to remain in that institution. Any questions so far, what I've talked about? Yes,
So you were saying how like, when you're first doing the evaluation on them to see like whether or not they're hallucinating, and like, it was the category where they think they have all the power. Have you guys been able to analyze whether that mentality developed at a certain age, or was it there all along, or like, are you guys able to like?
am I able to go into the past?
Yes.
I wish I was able to, but usually their mental health symptoms are to the point where I can't get anything from them. I use a lot of collateral information, sometimes parents, and I do research their records like throughout time, right? So if they were in multiple treatments, I can kind of see a pattern. However, usually when I'm one-on-one speaking to them, there's no real dialogue between us. Yes?
Do you look into the person's like family history, maybe like their father or mother, for example, may have a similar history with an individual? Would you look into it or no?
I would
Mhm.
if I had time,
Yeah.
but I usually don't have that much time, and I'm not doing like individualized care.
Mhm.
I'm just giving the judge an answer. The judge really wants to know, should I put this individual back on the street for treatment with you? Should I put him in a state hospital, which I guess he's treated every day and he's under lockdown? Or is he fine? Is he faking? Is he malingering his symptoms? And he needs to go to court. Does that answer your questions? Yes.
When you put them, like, let's say they're in that state where like they're Mickey Mouse, right? And they're highly medicated, is there ever a point where they can get out and they start recovering, or will they always stay there?
Everyone's different. Everybody's different. Some people, the highly medicated individuals such that are at Norwalk, if they ever get off the competency hold, they will go to jail because it's usually for a very bad crime. Does that answer your question?
Yeah.
Okay, yes.
What about someone who has schizophrenia or bipolar, but they're coherent?
You're coherent?
Yeah. like
Yes, yes.
That's a whole different process from someone who has schizophrenia or bipolar and isn't.
Yes, so that was the two different types of evaluations I did. So the diversion would be someone like you, we're having a conversation right now, and they had schizophrenia during the time when they committed the crime. We know our legal system, it takes a while, right? So sometimes the crime, when I'm face to face with them, the crime had happened a year ago. And it's usually substance-induced schizophrenia, right? Drug-induced schizophrenia. So you do have hallucinations and you are under substances. So there's two diagnoses that I can assign the individual. And if I can relate that to the reason why they committed the crime and the reason why, well, now that we're able to have conversations, I believe that I can treat them in the community. So that's one set of individuals, and then the other set of individuals, they're usually not going to be out. Does that answer your question?
I just, to follow up on the medication in the state facility, like under what conditions would they even decrease medication or think that someone was improving because the medication is kind of masking what's really going on?
Yes, that's the answer. I'm a psychologist, psychiatrist, deal with medication, and that's out of my scope of practice.
Okay.
So
Yeah, that makes sense. I'm
I
just
may know the answer, but you would have to ask a psychiatrist. for that.
okay. I'm just thinking that people would probably not be highly motivated to get off the medication or out of the system if they know that they're going to jail. So I don't know how much reasoning can be even happening there, but
The people in that environment, their schizophrenia is to the point where if they're not on medication, they are like running through the wall because there's somebody in the cell with them trying to get them. So they have to be pretty much sedated type medication, receiving that amount of
so there's
medication.
not a lot of change. There's not a lot of people
No,
doing that.
and then once your brain gets to that point, it usually doesn't bounce back.
Thanks.
Yes.
Like, what would happen if they found out like the person is faking it? Like, are they gonna add up to their sentence or whatever?
If someone's faking it?
Yeah.
Yes, there is. I do give two tests. You guys can Google it. I wasn't able to bring it. I couldn't find it. It's called the MFAST, M-FAST. It's called, I don't know what that stands for anymore, but there is. So if you take a sample of a population of people that you know have schizophrenia, like delusions, hallucinations, right? and you give them a test, they all scored the same. So fakers, they think they know what they're doing, but they do not know what they're doing. So yes, I have given that test. It's called the MFAS. I would give it to people when I think that they are faking. There is, as a clinician, you know, if you have schizophrenia, you have schizophrenia all the time. It doesn't just happen like when I come to class, I have schizophrenia, right? So a lot of people will say that to me, and then it'll like, my spidey sense will go off and be like, all right, I need to have objective evidence. So now I'm going to give you the MFAS. The MFAS, everybody that has schizophrenia scores one way. Everybody that doesn't have schizophrenia or is faking schizophrenia, they score another way. So you ask them weird questions. One of the questions is somebody under your chair right now? Every person that I've interacted with that has delusions and hallucinations, they don't care. They don't even know what I'm talking about. They're like, no, I told you there's hieroglyphics on the ceiling, Joe, and they'll yell that at me. I didn't say anything's under my chair. Someone is faking looks under their chair because I said it, right? So I am like kind of putting it out there, and they're like, and then they'll just, as the interview goes on, it says, how many times did they look under their chair? And then I check off. Every time they go like that, I just check it off. And that's objective evidence. And that's like the science of psychology. That's cool. You know what I mean? And there's people that like to study that stuff and create stuff for us to be able to use in a clinical setting. Answer your question?
Yeah.
Go ahead.
How do you determine if someone's behavior was substance induced during the commission of a crime?
How do I determine? They usually will tell me. I use meth, I use heroin, I think the newest one that I learned is a shroom stick. You guys know what a shroom stick is? It's a cigarette soaked in formaldehyde, and they smoke it, and it makes them hallucinate in their mind. And they would buy it, and they sell it readily. It's readily available where I worked at in San Bernardino. You just go on the corner and you can buy a pack of shrooms, and it's like $5. You get high real quick and you have your pack. But that stuff, you're putting this hallucinogen in your brain, and your brain is chemically changing. So over time, you're probably gonna start having some wild delusions and some wild hallucinations. So the question was again, how do I determine if?
So they readily disclose that information about their substance use?
Yeah. And if they were using, it's the culture, it's so common within the culture that they're not, and they're not trying to hide. They really want to get out of jail. And I'm very honest with people that I've interacted with. I tell them, I am here to help you get out of jail, and I'm going to treat you within the community. So just please be forthcoming and honest with me. And as long as they are, they're not like at a risk for violence. Like if the violent risk was I beat up everybody in my family, then I'm probably going to say no. I'll let them know at the end of the interview, there's nothing I can do for you. I have to recommend no to the judge, but at the end of our interview, I'll be like, I'm going to recommend yes to the judge. And then I'll go to the courtroom and say, yeah, I recommend him to be treated within our program. And like 2 months later, they're in our program, hanging out, having a good time. It's good. Any other questions? Yeah.
So you said you do recommendations for the judge. How many of those recommendations would a judge need? From how many different specialists? Or would it just be one from you, or?
It's one. It's
Just
mine.
one?
Yeah. So when I was interacting with the courts for the diversion program, I had to accept people into our program. And so it was me as an intern. I didn't even have my doctorate yet. I was still an intern when I was working in San Bernardino. And he took me as an expert in that field. He's like, all right, can you treat them? I was like, yes. And he's like, okay, you'll be released on this date. And then we would go pick them up and bring them to our facility. Our facilities that we had like an outpatient clinic where we had psychiatrists. I was a psychologist on staff. We had caseworkers. So we wanted to provide every avenue of approach to reintegrate that person back into the community, right? They put them in housing. Their housing had food. And every day, a driver would go pick up everybody from the house, bring them to our center. They would do groups throughout the day. They would have individual therapy sessions with a therapist, and then a caseworker would help them with meet their basic needs by getting making sure they had food, clothing, as well as helping them get an ID, maybe get on SSI because they do have a mental health diagnosis, and that would be income to make their lives better. So caseworkers would work and do that at the same time. Any other questions? No? You guys ready to play a game?
Yeah.
Who wants to be my volunteer? I'm gonna do an assessment on somebody right now. You do? I love it, I love it, I love it. All right, so we are going to do a public assessment. I'm gonna show you how our psychology assessments work. Cool?
Yeah.
All right, so. What's your name?
Ashley?
Ashley, I'm Joe. Pleasure to meet you today. See that instruction right there? It says, do not open this booklet and feel instructed to do so.
Yes.
I'm going to give you the instructions. I'm going to put it on the board as well. Can you help me make sure the Zoom people can see it?
Yeah.
Okay. So we're going to go along with Ashley. And have you guys heard of the Stroop test?
Yes.
Has anybody heard of the Stroop test? You have?
Yeah.
Great. Anybody else? Have you heard of the Stroop test? Good. All right. Yeah, we're going to put that one up. Ashley, don't look there, okay? You can't look there right now. So let's see if we can somebody hold a timer? Can somebody take time? Make a 45-second timer, please. 45 seconds, please. We're going to follow along with Ashley as she does this. So Ashley, at the bottom of that form that I gave you, there is 3 words in black on the left side. Can you read those aloud for me, please?
Bottom?
There's 3 words right here. Can you see those 3 words right there?
Yeah, blue, green, and red.
Can you say those colors out loud for me as well?
Blue, green, red.
See the colors?
Yeah.
All right, cool. You guys want one at this table? Yes, yeah. I'll put one at each table too, and then we'll follow along up there. I do need these back. Psychologists charge a lot of money for all their research to make sure it's evidence-based, and I have to pay for these. You guys have one? Okay, I'll give you guys one. Okay, so when I say begin, you are going to read from the top, down the column, go to the top, down the column. If you get all the way to the end and the timer hasn't gone off, start from the beginning again, please. And I will give you, you have evidence to show?
Yeah, yes. Thank you.
Okay, cool. Timer, you ready?
Yep.
Once Ashley says the first word, please start the timer, okay? Begin.
Red, green, blue, green, red, blue, red, blue, green, blue, green, red, green, blue, red, blue, red, green, red, green, blue, green, red, blue, red, green, blue, green, red, green, red, blue, red, blue, green, blue, green, red, blue, red, green, red, blue, red, green, blue, green, red, blue, green, blue, red, blue, red.
Stop. Thank you. Now, on the next page, you see the very next page?
Yeah.
Right there, leave it open. And I would like you to say the colors out loud as fast as you can. Remember, I need you to go as fast as you can. Your timer ready? All right, please begin.
Blue, red, green, blue, green, red, green, red, blue, red, blue, green, red, green, blue, green, blue, red, green, blue, red, blue, green, red, green, blue, green, red, blue, red, blue, green, blue, green, red, green, red, blue, red, green, blue, green, red, blue, red, green, red, blue, green, red, green, blue, red, green, blue, blue, green, red, blue, green, blue, green, red, blue, green, red.
Stop. Okay, now before you flip to the back page, I'm gonna give you an example. So I want you to read, say the color and do not read the word, okay? So right here, I don't know if we can see it as well. It says green, but it's the color red. So I need you to say red. See this one right here? I need you to say red. On this one, I need you to say, I think it's blue. And on this one, I need you to say green. Even though it's written differently, I need you to say it. Oh, thank you. I appreciate that. I need you to say, so this would be red, blue, green. Okay, you're gonna start at the top left and read down as fast as you can in 45 seconds.
Wait, on there?
No,
No.
Oh, here. Okay, okay.
Wait, she's gonna.
Can you turn the light on?
Okay.
You ready? Start the timer
Wait, from the bottom or from the top?
from the top left-hand corner.
Okay.
And then every one that you get wrong, we're gonna follow along. We're all gonna say no at the same time. So the last one gets one wrong, we two say no. Are you ready? All right, ready, set, begin.
Blue, red, green, blue, green, red, green, red, blue, red, blue, green, red, green, blue, green, blue, red, green, blue, red, blue, green, red, green, blue, green, red, blue, red, blue, green, red. Oh,
No.
blue. No, I was reading the one you guys said no to.
Time up. Thank you, thank you. All right, so do we know what that measure, that task measures? Does anybody know? Take a guess.
mental flexibility, like switching. Ability to switch tasks.
Close, very, very close, very close. Anybody else have a guess?
Cognition, but that's very broad.
Okay, that's broad.
I think
You
like-
already know, right? You
Oh.
said you know them.
Can you follow the instruction or not?
Following instructions. Close, yeah. Go ahead.
If I remember correctly, it's more like recognition. Like going to recognize it, well, less on the instruction, but more of the object.
Hmm?
Yeah,
All right, that task measures response inhibition. So you have to stop yourself from an automatic process. Reading for us is automatic. We don't think about it when we read, right? It's just automatic. But if you have words in front of you and it's automatically, I see red, blue, green, I have to stop my brain from thinking the way it has naturally been taught, however old you are, right? So 12, 13, 14, 15 years, whatever your age is, right? You learn to read one way, and now all of a sudden, this guy's in front of you and saying, I have to change what I'm doing. And what I'm actually measuring is if you are able to get back on task and continue with the assessment. That's what the Stroop task is made for. And a lot of people that I give this to, and they're unable to do the task, I will give them a diagnosis, but I'm not gonna tell you what that diagnosis is.
oh,
Okay, oh, I know, right? I don't want you guys to be like, hey, I think I have this. Because I did the Stroop test in class. No, I'm not gonna tell you what it is, but I would give a diagnosis if you failed this, and I also use other assessment measures. So if I do, I'm mainly a assessment psychologist, right? So I do a lot of assessments. There are mental health providers that do therapy, and I can do therapy, but what I like to do is assessments because I use an objective measure, I use a projective measure to give somebody a diagnosis, and then my clinical judgment as well, right? You're supposed to know the DSM, know about psychology, and then I use these measures so that it can hold up in court, hold up for Social Security, it can hold up if it's a workman's comp claim, it holds up everywhere because I'm taking me out of the situation. Does that make sense? So I'm going to show you another assessment measure that I do use, and I will show you the results of the assessment measure. So this is a PAI. Personality, I forget what PAI stands for.
Assessment.
Someone could Google it real quick. Personality what?
Internal assessment.
No, it's PAI, I forget what it stands for.
PAI,
MMPI.
I think assessment and inventory.
Inventory, yeah, that's it, there it is. I use that and the MMPI 3. I don't need to pass the test anymore, so. It's the MMPI 3. All right, but I do know what these scales mean. So this right here. So right 65 and higher. 60, what's this, 60 to 65 right here. So higher than 65 means it needs clinical attention. So I know you guys are new in psychology, but this is somatization, anxiety-related disorders, depression, mania, paranoia, schizophrenia, borderline, antisocial, alcohol, drugs. And this is a validity scale. So within all of our measures, I'm measuring to see if you're lying and you don't know that. So it makes it easy on me. So this right here, this bar are up here, especially near this line. I know I have to throw it away. You're lying to me, you're feigning your symptoms. It's not going to matter what you say. So if you're lying on that, as I'm interacting with you, you're probably going to be lying to me and I can't make a good clinical decision. I use that as well as, and I'll show you another measure. This is an objective measure, and then I use a projective measure. Does anybody know what a projective measure is? No.
It's a test that is intentionally vague so that the person will project their own personality onto it.
I love that. Perfect answer. That is a perfect answer. And the most famous one is the Rorschach test, right?
Yeah.
So people look at this picture and they just project whatever they want. Whatever they want to say when they look at this picture, they can say it to me. And then I write it down. And so many people have done this over time, and it's like free, that we have a huge database. And the database will tell me what you're saying, what it means to me, and how I make my clinical judgment. Now, if you are, say, schizophrenic, hoping nobody around here is schizophrenic, they probably say to me, these are two demons with their eyeballs and their mouths open. Can you guys see that?
Yeah.
They're two demons. However, they're in love and they really want to play patty cake with each other. That would be a common response. Now, what a normal person may say is, this is Tinkerbell.
Yeah.
Or a bunny rabbit. That's a very common response from a normal person. Or somebody you're allowed to flip these cards over, so I just hand it to you. And then if you flip the card over, you're turning it too much, that also means something too. So some people that flip it over, they'll use the white and say it's like a tree or a spaceship, or they'll just pick out a minute detail and say that is an ingrown hair. So they can project whatever they want in that assessment measure. So I use a objective measure such as the PAI or MMPI 3. I use a projective measure. And the last one I use is a IQ test. So I just want to make sure cognitively you are in your right mind. And this is a normal battery of block design similarities. All the measures are on the left, what I'm measuring, and you'll get your IQ anywhere from, I think it measures from 60 to 160. Most people are around 90 or 100. If you're really smart, which I know all of you are, you're probably at about 110, 115, 120. And then if you're like me, and you give it all the time, you can score a perfect score. So nobody ever wants to give me this assessment because I give the assessment. You know what I mean? So that is what I personally use for a diagnosis. So I use that. And then sometimes I will use another form such as a Stroop test, and they make a lot of different assessment measures to utilize to help with the diagnosis. So if I think something's going on, I'll confirm it with a specific test. Any questions? Well, I think that's pretty much all I have for you guys today. Hopefully it was informative. It's going to be very brief. Go right ahead. Yeah.
If somebody scores real low on the cognitive portion, what happens to them legally?
Legally?
Yeah, like if they committed a crime, but they're very low IQ or something like that.
Yes. If they are under 70, you can have an intellectual disability. And then I would narrow the type of intellectual disability down. And then from there, say they can't read, right? A lot of people, they go through life, they're unable to read. So they're going to score very low in the similarities, comprehension, and language skills. So I would let the judge know they have an intellectual disability in reading, or maybe computations, math, all depending on what it is. And
Do they still end up in the general prison population?
they can change, but they'll be fine in the general prison population. We're looking more at, is it going to affect your social functioning? Well, like if you can't read, is it going to affect your social functioning in prison? Probably not so much. Answer your question?
Yeah, they,
I saw a hand over here.
Oh, I was gonna say, how do you like base the diagnosis of the Stroop test?
How do I base a diagnosis
Yeah,
on the
like,
Stroop
how
test?
is it, like analyze?
Let me try to understand your question again. Go ahead. How do I
How do
use
you
the Stroop?
diagnose someone with the Stroop test?
How do I diagnose somebody with the Stroop test? All right, so I'll give them probably that assessment measure in an IQ test. And then from the IQ test, I'll see some inconsistencies and nuances that I'm used to. And then I will administer the Stroop test to confirm a diagnosis. I have like a bunch of different measures. I have like computer programs. I have the Iowa Gamble Task that measures decision-making ability. And I start to go down this pathway and I see these inconsistencies, and then I'll confirm it with the correct measure. And I guess I'm the art behind the measure. So give the appropriate one for the correct diagnosis. Yes.
Has an assessment, well, has this happened where an assessment is kind of outdated and you have to like, kind of give out and kind of learn how to do another updated assessment?
Outdated and learn how to do an updated one. Yes. So every assessment comes with a huge manual and instruction guide. And I can actually order any assessment, even if I haven't learned it. And then it's my responsibility to learn it,
Yeah, you're a
especially if I'm
student.
signing my name
Yeah.
and I can be held legally. You know what I mean?
Yeah.
So the outdated ones, I do have some outdated ones. Can I use them? I can use them for clinical, to help me with clinical judgment. Does that answer your question? Anything else?
I have a question. You just said that, sometimes you get new assessments and then, you have to like learn it at the spot. Well, you know, for that, prepare for it. And then you can be held, for it legally if you do make a mistake. So if you were to make a mistake and then obviously it's not intentional, what kind of punishment would you be facing?
If it's another professional, they report me, they let me know my mistake, and then I have the opportunity to correct it. So in the legal field, a public defender will hire a psychologist and I'll administer a bunch of assessments to you, right? And then the prosecutor will hire a psychologist. So within the courts, we're looking for inconsistencies versus each other. Does that make sense? And if he didn't administer a Stroop task, I'll say, I don't know why you didn't, if you thought it was this diagnosis, why didn't you administer a Stroop task? In my professional practice, that's what I would do. Outside of a courtroom, what's it called? The APA, our standard is you have to let the individual, you have to specifically let the individual know their mistake so they have time to correct the mistake. And then if not, you can report it to the Board of Psychology. Does that answer your question?
It does, but I do have a follow-up.
Go ahead.
So, if you like tell the prosecutor, okay. Prosecutor, yeah. Like, why didn't you administer a Stroop test? And they say, well, I don't know, I didn't think of it. And then what?
Nothing, because we're trying to convince a jury if it comes to that point. So it's both of them talking to us and we're just answering their questions, and it's only for the jury. So after that, we leave the courtroom and it's like, all right,
Just makes them less
you
bad.
wanna get something to eat? Because it's for the jury, because we're not making the decision for the crime. It's always a jury, and it's the lawyer's job to like look at inconsistencies, and they hire us as professional experts to find those inconsistencies. So hopefully, all of you are psychologists one day, you'll be like, oh, hey, Joe, you gave me that presentation one time, and now I'm gonna eat you up in court. And I hope that actually happens, and it's maybe likely to happen, right? If everybody wants to be a forensic psychologist, go ahead.
What made you choose forensic psychology?
Forensic psychology chose me. So I got out specifically, I was in the military, I was in the Marine Corps, and I got out because a lot of veterans lost their battle to mental illness. So I just wanted to be a mental health clinician. I noticed that I might not be as good as the engagement in therapy. And so I kind of fell in love with doing assessments, and I applied everywhere. I applied at VAs all over the place, and San Bernardino County hired me. So I got to learn about forensic and learn about working in the courts. You know, you just like float around and then you bloom where you're planted. Chose me, I didn't choose it. Anything else, guys? You have 5 more minutes and then I have to leave. I'm sorry. Go ahead.
So can you work in prisons and jails with just a master's degree, or would you need a PhD or something?
No, you can work in prison and jails with a master's degree. Yeah, I work with people and they have a master's degree, like an MFT, they'll be allowed to do it as well. Yes.
When you're applying to your doctorate program, how did you prepare in terms of like research experience and like that stuff?
I am a go-getter and I do more than I need to. That's the reason why I'm standing here in front of you right now. So like, as I was coming up throughout my career, I was always trying to do more, like assessment measures. I bought them on my own. I learned them on my own, and that kind of made me more prepared than my peers, because it's always you're going against your peers, right? So how do you set yourself up? How you set yourself in front of your peers, and I feel is doing more. Answer your question? Okay, cool.
So we have some questions here as well, but like, are there any dangers in forensic psychology?
Dangers?
Yeah.
I'll tell you a personal feeling that I had. So I get these people out of prison, and then I'm working with them in a clinic for a year, and then I get used to them. Like we engage with each other, we interact with each other at all times. I know their history. So it's hard for me, like if right now he was like, hey Joe, where you live? I'd be like, Mission Viejo. But when they say it, I like have to inhibit my responses, like the Stroop task, right? And it's very challenging and hard to do, so I don't feel that myself as much. If they're like, hell, you have kids? And I'll be like, man, I don't know if I want to tell you if I have kids. Those thoughts go through my mind, and people can tell when you're not genuine and you're actually doing that. You know what I mean? So I found that out pretty early in my career. So now I just say, I don't want to answer that question. Before they would know if I was like trying to lie or figure out a story, but I was just like, I don't want to answer that question. Or I'll be like, dog, I don't tell people where I live. I just don't say that.
Yeah.
I'm gonna tell you what you, right now, I'm honest now. Like, I'm not gonna tell you where I live, dog. I know what you did. I'm not gonna tell you where I live. They'll just laugh about it like you are, but that builds rapport because we're being honest with each other. People can feel when you're like faking them out, you know what I mean? Not being as genuine.
Yeah, there's another one.
ahead.
Are there any other career options in forensic psychology aside from like being with prisoners and inmates?
Yeah, the expert witness. So like what I was telling you, and you work for the courts. So you could just work for a law firm. And for instance, if you're at Home Depot and a ladder falls and hits you on the head, right? And then you go to a law firm and you say, I want to sue Home Depot. The Home Depot, well, the lawyer is going to say, I need a psychological evaluation to show that your cognitive functioning has deteriorated. So then they'll hire myself and I will do an assessment.
So it has to be like, doesn't have to, but like it's more like in the law
legal.
Okay, so
types of-
forensic means legal.
Okay, yeah, thank you.
So it's always something that has to do with the court's judge. That's what forensic means. So forensic psychology, that
Thank you,
forensic
thank you, sir.
means legal psychology.
Also, has it impacted you mentally, aside from the interaction you had with the hesitation?
Has it impacted me mentally? I have a great social support. And as long as you maintain and have a great social support, like family, extended family, peers, and I have consultation, I still have my peers. I call them on the way to work. They call me and they're like, I have to deal with this person that's bipolar this morning. Bipolar, first thing in the morning, I hate it. And we talk about things. So I use my friends and social support so it doesn't affect me as much.
Okay. Um,
Go ahead. There's
So
one more
since-
question, but go ahead.
So since it is forensic, is there like a lot of time you need to keep things confidential, like you can't share it with your friends and stuff?
Yeah, a lot of it is confidential because I can't share their names. However, if they look them up, I mean, everything that I say, well, the people that I interact with, they're readily available online. Like you can just type them, you can type in their name and information and you can see who they are. But do I share it? No. Go ahead, you have more?
yeah, other than becoming a clinical therapist, what are some other, this is really separated, but what are some other career options that you can kind of obtain with a side?
With the side D? Career options, I could do therapy. I can do assessments. Expert witness. I'm trying to think outside the box now. I could be an evaluator, mental health evaluator. Or I don't, there are so many places that use assessments. Like if I left Irvine Valley College right now, I would get a job immediately. I can do social security evaluations, always. I can go to the prison, do evaluations, always. I can always do these workers' comp evaluations, like mental health evaluations, all the time. There's a huge field, people, mental illness, mental health. I don't think it'll ever stop, so I think I will always stay in business. You have more?
No, that's.
I think there was one question. What's the difference between a PsyD and a PhD, correct?
Yes.
Okay. I thought about this question because I have peers that are PsyDs. I have peers that are PhDs. PhD, the program is more research-based. A PsyD program is more clinical-based. So for the PsyD, I had to do 4 years of interacting one-on-one, face-to-face with people. PhDs will have to usually publish a quantitative research study based on data.
Only one,
What's that?
only one?
That's your
I don't know.
thesis.
I'm really not a PhD. I had to publish one too, but and mine was research based, but usually there's like grants and funding that go into the PhD at the PhD level in psychology, and you're probably changing the Stroop task or recreating the Stroop task if it's probably just in psychology, or changing the validity and reliability of it. Anything else? All right, guys, thank you for your time.
Guys, please forward this assessment test back, please.
Oh, yeah, I need my papers back. These things are expensive. I can go? Yeah.
Thank you.
We like, but should we make you leave it or should we take it? We're discussing whether we should leave or take this.
Your group if you want.
God.
Have fun, have fun. Yeah, send it. Please send it. And it is.
That's why we were trying to catch the bus. Well, we tried to catch the bus on time. 1 second. Oh, it's 20 birthdays.
Yes, okay. There we go.
Yeah.
You don't need to see me, right? I promise. Like, they can just see the slides.
Right, birthday on Oh, okay, good.
For this one here for today, what's this one for?
All right,
Yeah.
so,
You know, like Sarah.
okay, gonna do our mental health segment now.
I am
Before
not sure
go
if we need to
into
put the
actual
time
mental
here
health
for the
segment,
time.
I'm
If
gonna
not
do
in some way,
a thing.
Michael and I will put we'll
I
put it
have
in.
a bit of a soapbox that I'm on this semester, and it is about misinformation and disinformation and real data. So all of my topics this semester are going to be about a specific thing, but we're also going to talk about what the data actually shows versus what it does not. Okay. So the topic I'm talking about today is mindfulness meditation and its effect on mental health. And it was actually a suggestion that was given to me by one of our members at last meeting. So thank you for that. That did not work. Okay. So what is mindfulness meditation? So first of all, it can take a lot of different forms. It is often techniques and ideas that are borrowed from Asian religious traditions, although truthfully, when they are used in North America and in Europe, they are stripped of those cultural and religious meanings. Zen and yoga are probably the two specific examples that everyone knows about. But basically what it all comes down to is it is an exercise to try and calm a person's thoughts or even physically calm yourself down. And it's growing in popularity right now, both as an adjunct to talk therapy and just in the general population. We all know about being mindful and trying to take deep breaths and all this stuff. So I've got 3 studies I'm going to share. One was a breath counting study. I found this one really interesting because they talked about in their introduction that the big difficulty with studying something like mindfulness and meditation is how do you operationalize your terms? Because it's very difficult when someone is like, I'm calm, and my mind is calm. So well, what does that mean? So these folks used a specific breath counting task where they had their participants breathe in and breathe out and hit a button on a keyboard. And then they had to count them. And when they got to the end of the sequence, they hit a different button and then they started again. If at any point during the breath counting task, they lost track, there was yet another button that they pushed and then they started over again. And so they were able to actually determine what folks were doing and whether they were able to continue the task. So the participants completed questionnaires about anxiety, depression, and overall mood. Overall, most participants did really well at this task, regardless of whether or not they had cognitive challenges or not, because another part of the experimental process was to, at some points during the task, ask someone a question, pop them with an unexpected need to respond and stop counting their breaths. And people actually handled that really well. So there was no significant correlation between success and whether or not people had the anxiety or depression, but it was noticed that folks with both very high moods and very low moods both reported that their moods moved towards a more neutral state while doing the task. And those who scored much higher on both depression and anxiety noticed a greater change in mood towards a more neutral mood than those with lower scores. So for folks who were a little depressed, they noticed a little change in mood, but for folks who were extremely depressed, they noticed a much greater one. Okay. Another study was the use of transcendental meditation for veterans with PTSD. Transcendental meditation is a specific type of meditation where sound is used as the focus. And it's often meant to be a sound that does not have any meaning on its own. It's just a syllable, it's not a word. And the theory is this allows the mind to settle because you are doing something, because brains like to be active, but it's not meaningful. So the participants in this were all veterans who were receiving services and had a diagnosis of PTSD. They were taught the transcendental meditation technique and they received both group and individual therapy related to the program, which ran for 8 weeks. This actually had some pretty significant results. 14 out of the 23 participants showed a clinical reduction of PTSD symptoms after 8 weeks, and that persisted until the 2-month follow-up at least. And the last study is about mindfulness and long-term mood management. So there is a specific type of cognitive therapy that has been developed. It's called mindfulness-based cognitive therapy. It's a very structured program. And so this study was to determine like the numbers. And so it has been shown to reduce the relapse or reoccurrence of symptoms with major depressive disorder. But like the first study, this data was most significant with patients who had suffered 3 or more relapses in symptoms before starting this particular type of therapy. There was no statistically significant difference in relapse of symptoms when the study group consisted of people who had 2 or few relapses. So that I thought was really interesting. So this is conclusions, and this is where you're going to get a little bit of my opinion. So there absolutely is evidence that mindfulness meditation and mindfulness-based cognitive therapy are effective at relieving the symptoms of mood disorders. I don't think anyone's going to argue with that. And there's also evidence that they are both more effective the worse the mood disorder is. So basically what I'm taking from this data, my interpretation of it is that if you are just as a general member of the population suffering from anxiety or depression, and you want to add mindfulness meditation into your current therapeutic regimen, it will probably give you some benefit. However, it may not be super beneficial if you have a stable mood. Like, it may not make you feel any better. It probably won't make you feel worse, but like, it's just generally seems to be works better the worse off the person is before they start treatment. So here are my works cited. And thank you very much.
Yeah, I had a question.
Sure.
So were you able to see how long each one of these studies took? Like, how long were they testing it out for?
Did I write it down? I don't remember. So the one for the veterans was specifically an 8-week program. The breath counting task was shorter. Like, it was the participants were taught the breath counting task, and then they were tested on it about 48 hours later. So the once. The last one, because the last one was much longer because it was people who were already in therapy, and that was, their therapists were like, we're going to try this new form of therapy. So that was I don't know the exact time. It is absolutely in the paper, but I didn't know.
Thank you, that's really great.
Anything else?
As a reminder, if you want to reach out to us, here are the 4 ways that you can do it. We have our Instagram, which is updated weekly. We have our Facebook page, which should be updated more. But the best way to reach us would be, of course, our Discord. It is going off every day. Yeah, we put up reminders and all that stuff. So Discord is number 1 place to go. We also have our Canvas shell, which if you aren't in there already, just email Sina with your IVC email and she will add you to it. Then here is our QR code or the Discord if you would like to go in there. Thank you.
Before we officially end our meeting, I would like to make some important announcements. First, students who are participating in the WPA convention, please submit your form to Professor Mark or Professor Patricia. They're not present here right now.
I'm gonna collect them.
Oh, so Sina will collect them for you guys. And if you have not printed out the form, specifically for people who are online, you just have to step into the room, right? Yeah, in room, in this building, Mystic, room 202H. And second announcement would be the fundraiser. So our fundraiser is happening as we speak. I speak, sorry. Come in anytime and to 7 leaves before they close at 11 p.m. Present the flyer through the Discord channel and announcement section specifically. So that 20% of your purchase will be given to us. And if you picture yourself, and put in the story, tag 7 Leaves and Sci Beta, we will get $1 extra for every post. And that's all. Thank you so much. Oh, any
Please
questions?
go to the fundraiser and support us. It goes back to you, I promise. Okay. I think we're all good. If you have any questions- Yes.
The forms?
Yes.
Okay.